Good evening, everyone. Welcome to Pediatrics by Dr. Anand. Is my beautiful voice coming? Yes or no? Good evening, everyone. Such a beautiful day today. Why? Why it's a beautiful day? It is a beautiful day because we get to share knowledge. We get to be ourselves. We get to learn something in life. We get to spend beautiful time with our friends. We get to love our family, and we get to be ourselves because you are unique, and that is the best thing about you. Good evening, everyone. Welcome to Pediatrics by Dr. Anand. Today's beautiful day. Why? Because I have got little cough. No, that's not the reason. Because life is just beautiful. My name is Dr. Anand. I've done my MBBS from Rajiv Gandhi University Health Sciences. Then I did my beautiful MD in the field of pediatrics. Then I did my SRship from Lady Harding Medical College and NDMC Medical College. Then beautifully I realized life is such a beautiful gift. We need to be happy for whatever we are. Then also we have some teaching experience, some 7 to 10 years. I don't remember when I started teaching, and I just only remember in my starting from my final year MBBS, I used to I used to drag people, and I remember three people used to sit in my classes, and I was like, can I teach you features of right heart failure? Right atrium is not able to pump the blood to the right ventricle, so right heart failure. It will lead to a back pressure, lead to periorbital swelling, facial puffiness, raised GBP, tender hepatomegaly, and like that I used to teach everyone. And then life has become so beautiful journey. Everyone is a part of it now, and we have some beautiful pillars of life like Osama, Shubhangi, Shubham, Amrit, Karan, and all the beautiful people. Grace, Manish Yadav, Faizan Raza, Alfaz, so many people. Let's start this class. Yes. So today's beautiful quote we have here is work until you feel Dubai is cheap. Now this is the crazy quote for the evening. I liked it. Did you like this quote? Let me know. Yes or yes. So much we need to work hard in life in a positive way, in a happy way, in a genuinely comfortable way. Work until you feel Dubai is cheap. So how many of you feel Dubai is cheap? Don't tell me people will say Dubai is cheap, sir. Package I have is very cheap. Is it? Is it? Yes or no? Yes. Dr. Ashutosh, good evening, sir. And Shubhangi Kaushik, Alfaz Memon, and we have Karan Vikram Singh, Sushmita Mondal, Bhavna Mankar, and Dr. K, and beautiful, amazing people. Alfaz says, Kaise ho? I am pretty good. What about you? Yes, today is a beautiful day. Let's share some immense amount of positive and good vibes and a good knowledge. And this quote I really like: "Work until you feel Dubai is cheap." So once you book your flights, you should be like, just book it. I don't know, just book it 5 nights, 6 days, maybe. Like that. It feels so nice. Yes. Okay. Let's start this beautiful class. Today we're gonna finish the case presentation. The basic 4 5 videos we have amazingly, immensely, beautifully finished regarding the case presentation. And today we're gonna talk about the past history, family history, dietary history, and antenatal history. The last half of a basic case presentation. One of the very beautiful, very important slides. Please remember. And I'll be having little cough and cold. Don't mind. In the past history. Now let's talk about it. In a case of case presentation, general, can you give a light on what all past histories are important? Like as in, can you tell me any diseases which are connected with the past? I was in a relationship, it is connected to my past. Not relationships, but in general, bro. Tell me, what are the important aspects? Anyone? Yes. What are the serious causes? Perfect. Lovely question. Lovely question. And I'm having zukam. Okay. I'm having cold. Don't mind. Okay. Just close your ears once I blow my nose. Okay. I'm sorry. Yeah. Yes. Serious causes. Okay. I'll ask you a question. You tell me the answer, because I will never tell you the exact answer because I am your well-wisher. I will indirectly ask you a question. You need to tell me the answer. In the serious causes of past history, if I say the baby has history of suck, rest, suck cycle, suck, rest cycle. Oh, I speak like a Punjabi. Suck, rest, suck cycle. Cute. Yeah, bro, tell me. If I say I have a history of suck, rest cycle, what do you think? What I'm dealing with, bro? What do you think, guys? Any beautiful people can answer some beautiful, amazing stuff? Yes. Can I say of the tetralogy of fallow? Tetralogy of fallow is a very beautiful condition where we expect the patient should have a suck rest cycle, because I'm having progressive infundibular stenosis, and that's why, because of the whenever I will cry, I will have an infundibular spasm like a TED spell, and I will suck the nipple, and then I'll get breathless. I might get a diaphoresis, and I take a rest. Again, I'm hungry. Again, I suck the nipple. Again, tachycardia, tachypnea, and diaphoresis. So, suck rest cycle is a typical beautiful feature of tetralogy of a fallow. Beautiful. Yes, Dr. Shubham is right. Perfect. Again, another CVS cause. CVS, yeah, okay. I am a baby. I am a baby who has a history of cough and cold 2 weeks back. What is your best differential diagnosis? Can you please answer in the comment section? If I have a history of cough and cold 2 weeks back, and I came to you today to Dr. Shubham, one of my favorite junior from Vikaspuri, his address I will WhatsApp you if anyone want to kill him, because he answers, sometimes he answers wrong. Hanji, if I have a cough cold 2 weeks back, today I come to you again with CVS cause you think is important. Anyone? Yes. Yes, okay, nice. Yeah, the beautiful answer on this planet. Can I say acute rheumatic fever, or can I say rheumatic heart disease? Yes or yes. Beautiful answer. Amazing, beautiful students like Hennebert, Shubham, Sarthak Praharaj, Priya Gupta, Osama Sheikh, one of my favorite juniors, and yes, replying beautifully. So this is the beautiful brains. We are the king and queen of our own life. Let's rule it. Let's kill everyone. Oh no, not kill everyone in a real way, but let's just rock the stage. So in this beautiful class, we understood that in the past history, if I'm taking a CVS case, I must ask the history of cough and cold, because acute rheumatic fever is something I can think of in my beautiful, amazing brains. Also, at the same time, if I have a suck rest cycle, I can think of tetralogy of fallow. Yes. So this part is over. Cyanotic spells is over. Yeah, beautiful question. If I, in a case of GIT, such a beautiful question, guys, can you please use your 250 grams brains, 250 gram brain इस्तेमाल करें? Hanji, yes, beautiful buddy. Yes, Dr. Osama Sheikh, you're right. Revised John's criteria is an acute rheumatic fever, and acute rheumatic fever, the most common age group is 5 to 15 year. Bang on, very good. Next question. In this beautiful case presentation, I am thinking of a GIT case. Pertaining to GIT, can you tell me some significant past history, some beautiful, amazing brains? Brian, I'm saying brains. Can you use it? Hello. Yes. If I say my patient, ma'am, there is no history of chronic diarrhea, what are we ruling out? Such a beautiful brains. I love this knowledge. Hanji, can you please answer in the comment section? Osama, Sarthak, Praharaj. Yeah, Sarthak is also like nowadays our hardcore follower. Yeah, Dr. Sarthak, yes. Dr. Sarthak has thing. Hey sir, good evening. I have enrolled for your FMG binge revision classes, and please help me with the INICT enrollment on 2nd November. Yes, dear Dr. Sarthak, you are most welcome in my arms, brother. Please come. Yes, so in this beautiful chronic diarrhea, the best answer can you think of? Chronic diarrhea. Karan Vikram Singh has the beautiful answer. Celiac disease. Beautiful. So that's how you have to connect. Okay, you have amazing brains. If the patient has, if the patient has a history of chronic diarrhea, I'm having what you called doctor, my child is having diarrhea from last 2 years. Whatever gluten or rice, chapati, pizza, sandwich, hot dog, or muffin, or a blueberry muffin rash, like blueberry muffin, if my baby takes, the baby has a diarrhea, I should think of celiac disease. Okay, doctor, ma'am, there is no history of constipation. There is no history, or like, okay, if I say my patient, there's no history of chronic constipation. What beautiful, amazing, what you called, you can think of any differential diagnosis. Such a beautiful Osama. Okay, I recommend everyone like Osama is answering extra points. If someone has any beautiful, amazing points, please mention. And Sarthak might be having some extra points of whatever I'm speaking. Like, for example, Shubham, do you remember? Sarthak was saying that day, sir, could you explain modified Gant's criteria? What was that Gantt criteria? Where it was? मैं तो पढ़ा भी नहीं literally. Where is that Gantt criteria? Dr. Sarthak Praharaj, you were saying that day. So कहाँ था? हाँ, chronic constipation. Definitely. Can I think of cystic fibrosis if I have a chronic constipation? In a newborn constipation, can I think of Hirschsprung disease? Can I think of congenital hypothyroidism? Yes or no? Or can I think of Down syndrome? Such a beautiful knowledge, guys. Please remember, in the case of Down syndrome, the whole metabolism gets slow. I have seen so many patients of Down syndrome coming to us. Sir, this constipation बहुत रहता है. Sir, this my baby has a long time, from a long duration constipation. And please remember, it is Down syndrome, not Down's syndrome. Okay, remember, it is Down syndrome according to latest update. It is not Muru's reflex. Anyone? Is it Muru reflex or is it Muru's reflex? Can you beautifully answer in the comment section? Yes, very right. Shubham is right. Sarthak Praharaj is right. So it's a Muru reflex, not Muru's. It is Down syndrome, not Downs. Okay. So if I have a chronic constipation, ma'am, there is no history of chronic constipation. Definitely, Karan Bikram Singh is right. Hypothyroidism has chronic constipation, celiac disease, cystic fibrosis. I can say. Remember, okay, I told in this beautiful classes, I remember celiac disease, where I have a gluten sensitivity, where I am obviously like allergic to gluten products. I might have a chronic diarrhea, and also I might be a case of chronic constipation. Please remember this, okay? Lot of has have this doubt that in celiac disease is only diarrhea, diarrhea, diarrhea. No, bro. Because of diarrhea, the patient can have a chronic constipation also. So my patient has constipation, GIT causes celiac disease, Down syndrome, cystic fibrosis, Hirschsprung disease, and very beautiful Marfan syndrome. Very beautiful Marfan syndrome. And I hope you know that the most common congenital heart in Marfan is which one? Anyone? Can you answer in the comment section? Yes, Sarthak Praharaj is right. Very beautiful. Hirschsprung disease, as there is a transition zone, as there is a aganglionis. So yeah, exactly, aganglionic megacolon. That's right. Has everyone beautifully understood? Yes or yes? Yes. Today I had lot of happy. What are you? Karwa Chauth. I was saying, not Karwa Chauth. Happy. This one. What do you call Kanjike? किसने रखी आज कंजके? Has anyone celebrated today's beautiful festival? That's right. The most common congenital heart in Marfan is a mitral valve prolapse, and the most common cause of death in Marfan is aortic dissection. Next question, please. Next question. If I have a past history of jaundice and repeated blood transfusions, what beautiful differential can you tell me? Your time starts now. Yes, yes. Beautiful people answer beautifully. Yay, amazing people, amazing people, amazing people. Yes, very beautifully told by our amazing, immenseful students. That's right. Hanji, you're very, very good. Perfect. That's true. Okay, 1 second. 5, 4, 3, 2, 1. Okay. That's right. Okay, so that's, I hope you know that infective hepatitis, I must remember if I have a very beautiful what you call history of the history of jaundice and blood transfusions. Chronic diarrhea is over in the CNS. Okay, yeah, such a beautiful question. Now, such a beautiful thing. This is like, can we appreciate this knowledge? If I'm asking a past history, we beautifully ask past history containing to the cardiac, like a history of TET spell or a suck rest suck cycle. Then beautifully we ask regarding the GIT past history, like celiac, Hirschsprung and all that. That also was very, very beautiful. I hope you're understanding. अभी तक समझ में आ रहा है सबको? Is my beautiful voice coming? Yes or yes, yes. Please put a thumbs up. Are you able to understand? Yes or yes, yes. तुम आजा मेरे बादशाह एक वादे के लिए Beautiful. If I say, yeah, history of recent vaccination. I remember when I was in Lady Harding Medical College in the case presentation, the examiner used to ask in the negative history, why have you asked history of recent vaccination? Can you tell me any one basic disease in pediatrics where you have a recent vaccination history? Yes, okay, that's right. Karan कह रहा है आज मैंने पाइका का केस देखा. That's beautiful. How do you define pica? I hope you know that. History of there's a history of eating non-nutritive substances such as wood, charcoal, paint, and earth in a manner which is developmentally not acceptable, and even socially also it's not acceptable. Pica people can lead to iron deficiency anemias, and they can lead to lead poisoning, and deworming is important. Yay. Perfect. Acute flaccid paralysis, yes. Very beautifully told by Dr. Priya Gupta. In a case of poliomyelitis, that's what the history of recent vaccination I can think of. Connection, poliomyelitis is important. And okay, the patient has a history of recurrent convulsions or recent abnormal movements. Can you please answer in the beautiful comment section? What do you think? What your tiny beautiful brains can think of? If I say the patient has a very, very beautiful, what you called history of convulsions. Yes, beautiful. Yes, yes, very good. Very amazingly told by our amazing students. If I have a history of recurrent convulsions, of course, can I think of meningitis? Number one. Can I think of encephalitis? Number two. Even in this case, if the child is between 6 months to 5 years, can I beautifully think of febrile seizures? If my baby is a neonate, can I think of neonatal sepsis? Neonatal sepsis. This is immense beautiful knowledge. We must appreciate this. Okay, जबान नहीं खुलेगी तुम्हारी एग्जामिनर के सामने. अभी तो बड़ा आसान लग रहा होगा. In the front of the examiner, you will be, kind of a closed grip. So you need to have a beautiful knowledge. If examiner asks you, why history of convulsions, like it's such a basic question, and my HOD used to say that basic common things are common and rare things are rare. Nobody is going to ask you where do you use nitisinone and ivacaftor. That's another thing, that ivacaftor is used in the medical management of cystic fibrosis, and nitisinone is used in inborn errors of metabolism in phenylketonuria. But in general, you should know that, ma'am, there is no history of history of convulsions. Why did you ask convulsions? Ma'am, if my patient can be a case of febrile seizures, if it is a newborn, neonatal sepsis can have seizures. If my child is an adult or adolescent, the patient can have meningitis or encephalitis. Beautiful point. Please appreciate knowledge. जिंदगी भगवान की एक बहुत महंगी गिफ्ट है. Ooh. Sir, there is no history of contact. This is obviously it's important. Number one, like it's such a beautiful thing. Can we appreciate? I love sharing knowledge, like I am so thankful to God that we are able to connect on a digital platform and we are able to talk to each other. This is important. You किसी का भला करके जाओगे तुम, so you will be helping some patient. Okay, you should know that. Question number one, what is history of contact, and why I'm asking history of contact in my patient? Can anyone beautifully answer in this comment section and throw some beautiful knowledge over here? I hope you know that. Sir, there is no history of contact. Why did you ask history of contact? Sir, if I'm thinking of tuberculosis, number one, obviously in a case of contact, history of contact, TB is something I must kind of think of. Can anyone beautifully answer? How do you define contact? Can you beautifully answer in the comment section? How do you define contact? Any idea? Okay. ओके सर, आज जो बोल रहे हैं वो आधी हो जाती है नॉलेज. ओके. करण कह रहा है जो आप बोल रहे हैं वो नॉलेज आधी हो जाती है एक्सटर्नल के सामने. यस ब्रदर, आई टोटली एग्री विद यू, बट दैट्स व्हाट वी नीड टू हैव अ ब्यूटीफुल नॉलेज. ओके, शहबाज खान सेज दैट. ओके, परफेक्ट. या ग्रेट, वेरी गुड. हाँ जी. या व्हाट इज कॉन्टैक्ट? बेटा जान से मार दूंगा गलत आंसर किया तो. शुभम कहाँ है? शुभम, क्या होता है कॉन्टैक्ट? इधर क्या होता है कॉन्टैक्ट? व्हाट इज कॉन्टैक्ट? ओसामा कहाँ पे है? ओसामा, आई एम चेकिंग योर आंसर. For you to be my favorite student, you need to be top on the list. I'm sorry, but this is life. Huge competition. You want to be good? You have to prove that you're good. Okay? There is no mercy over here. you have to be strong and you have to prove that you are actually good and people will respect you. वरना तुम्हें कोई पूछेगा भी नहीं, और यही जिंदगी का आसार है. Are you understanding what I'm trying to tell you? Okay, हाँ जी. अच्छा, कोरोना वायरस, क्यूट, नाइस. मिलावट. ड्रामे, बातें करा लो, बातें, बस बातें, उससे बातें करनी बड़ी मजेदार होती है. हाँ जी. व्हाट इज कॉन्टैक्ट ब्रो? ओके, फॉर एग्जांपल, ओके, if I stay with my auntie and 6 months back, okay, I have a question, let's go. I love playing question answer. I'm staying with my aunt, and 6 months back my aunt, she took anti-tubercular therapy. So, am I a candidate of history of contact? Yes or no? Can you beautifully answer in the comment section? This is case number 1. Case number 2, I'm staying with my aunt. 2.5 years back, she took anti-tubercular therapy. Am I the history of contact or not? So question number 1, yes or no. Case number 1, is that person a history of contact or not? And case number 2, is that person a history of contact or not? Can you answer beautifully in the comment section? Your time starts now. Day after tomorrow, I have my class in cerebellum. I hope you know that your favorite Dr. Anand has joined Cerebellar Academy under the beautiful shelter of Dr. Apoor Mehra, one of my favorite senior sir and mentor. So 600 students are like, the whole audience is booked, bro. I'm gonna take a selfie. I'm gonna take a selfie video. Hello everyone, welcome to Pediatrics by Dr. Anand. Behind me, we have a beautiful crowd. Can we say a hi everyone? Like that I'm gonna start. And they'll be like, ooh. Really happy and excited, but nervous also at the same time. Osama has the right answer. Hennabert, I'm sorry, that's the wrong answer. Okay, Priya Gupta, no. Kaun se wala no? Okay, beautiful. Who is a contact? Okay. If any person is in contact with the patient who is an open case of tuberculosis and on treatment or has completed treatment within 2 years of life, this is beautifully known as contact. I'm going to repeat again. If I'm staying with someone in my house who has been taking ATT or who recently took ATT within 2 years of life, 2 साल या 2 साल के अंदर किसी ने मेरी फैमिली में टीबी की दवाई खाई है या खत्म करी है, within 2 years of life, anyone in my family has taken a ATT or has finished a course of ATT is known as, I will say, I am a history of contact. Okay, that is why in case number 1, where my aunt took ATT 6 months back, I am a case of history of contact. Yes, and in case number 2, my aunt, she took ATT 2.5 years back. That's not the history of contact. Very beautiful. And also, if the examiner is little hi-fi, who is a MBBS, MD and DM and MRCP CH with FNB fellowship, he'll be like, can you tell me, Dr. Shubhangi, on the basis of hours, how do you define history of contact? So that time you don't get shocked, just, answer. So according to history of hours, people who has shared an airspace with a person having TB in the household or any indoor setting for more than 15 hours per week. किसी ने तुम्हारे साथ, if anyone with you has spent more than 15 hours in a week, number 1, or more than 180 hours in a, like, more than 180 hours of total during an infectious period time, I will say you are an ideal and a beautiful candidate of history of contact. It's like a hi-fi answer. It's like a from the Nelson and hi-fi books I have taken. Please remember. Yes, I'll repeat again. If you and me are staying together and if you have TB, I have shared more than 15 hours per week with you in the same house and more than 180 hours total during the infectious period, I will say, ooh, I am a history of contact. You should know that. Okay. Dr. Sarthak Praharaj says, Dr. Anand sir, OP. OP क्या होता है bro? OP का मतलब नहीं पता Praharaj. Karan says, कल होगा धमाका. कल नहीं है, परसों है क्लास. गुड्डू, कल नहीं है क्लास. कल चेक करने थे, मुझे पता लगा कल ही है. आज कौन सी तारीख है? Today is 3rd, no bro. 5th is the class, and we have a class in Mumbai also. There also the batch is full. Ooh, we're gonna cover pan India. It's gonna be amazing. Then पीछे से आवाज आएगी, तो आ रहे हैं डॉक्टर आनंद जो लगा देंगे स्टेज पर आग, फिर एक लड़की बोलेगी अरे कहाँ है आग, देन दैट पर्सन विल से अरे बाबा जलवे की आग. I remember that. Okay, has everyone beautifully understood? 30 minutes of amazing class is over. Okay, OP is overpowered. Love your short forms. Okay, can we have a quick recap? In this beautiful, amazing class, what we understood, we are coming to the end of the case presentation and we are in the amazing, beautiful past history. In this recap, we understood we need to work in life until we feel Dubai is cheap. Also, at the same time, past history is important and past history is divided into system wise. In a case of CVS, past history, I could think of. Tetralogy of fallow, I'll say history of suck rest cycle. In a case of acute rheumatic fever, or rheumatic heart disease, I will say a recent history of cough and cold. And also beautifully GIT, constipation history is important. Sir, I would like to rule out in constipation, Hirschsprung disease, Marfan syndrome, Down syndrome, cystic fibrosis, and amazing celiac disease. Beautiful, bang on, beautiful points. Like, पता है मुझे समझने में बहुत टाइम लगा था ये. You must be thinking it's like a piece of cake for anyone to answer, but frankly speaking, I am a very average student, and staying on this level, something like 5-6 differential like on your face, it literally took me a hell out of time to learn, revise, and today to present in front of you and saying 5-6 differential as in मैं जैसे फूल बांट रहा हूँ करके, as if I'm distributing flowers. So are you understanding? Yes or yes? Please let me know. Then also we understood history of jaundice. I can think of acute viral hepatitis, acute liver failure, acute hepatic NCAF, and everyone knows the name of the staging for acute hepatic NCAF is Westhaven classification. History of recurrent blood transfusion, I can think of sickle cell anemia and thalassemias. Then also in this beautiful class, past history of chronic diarrhea, I would like to rule out inflammatory bowel disease, ulcerative colitis, Crohn's disease, celiac disease, cystic fibrosis. CNS infection past history, sir, there is no history of recent vaccination. I'm trying to rule out poliomyelitis. There is no history of ear discharge. I'm trying to rule out any, even a acute rheumatic fever, the patient can have cough, cold, and ear discharge. Convulsion, I'm ruling out meningitis, encephalitis, and febrile seizures. Yes, history of contact is over. If I'm staying with you within 2 years of life, you were taking ATT or you have finished ATT. I am a contact, like I am an ideal candidate of contact. According to hours, we understood if we are living together in 1 week, we are staying more than 15 hours. In total duration, if I'm staying more than 180 hours with you, ooh, I am a contact. Has everyone understood? Yes or yes? And please, can we appreciate my biceps like this? शुभम कुछ बन रही है यार, हल्की सी बॉडी है यार, मेरी बॉडी नहीं बन रही, बड़ी प्रॉब्लम हो रही है लाइफ में. आई हैव 250 grams of biceps, please help me what to do. Okay, so Sarthak says, sir, which food item should we advise a patient of celiac disease to take apart from bro items? Oh, that's a beautiful answer. 1 second. Okay. Okay, a very beautiful answer by someone who is beautiful and someone who is answering beautiful nowadays. Yes, let's just have a very beautiful answer you have told. Let's just talk about it, celiac, because you have told this. तेरे भाई ने एक एक शब्द का notes बनाया हुआ है. Your dear brother has made amazing notes. So let's see what we can eat and what we can't eat in case of cystic fibrosis or celiac disease. So yes, in a case of celiac disease, beautiful answer is number 1, gluten-free diet is something is important, as you all know. Also, what is allowed? Is pure oats allowed or maize allowed? Yes or no? Yes, pure oats is allowed. Dr. Sarthak Praharaj, always asking hi-fi question, and you are hi-fi. Chapati, rice, jawar, wheat, barley, is it allowed? Yes or no? Oh, not allowed. Chapati, rice, jawar, wheat, barley is not allowed. What is wheat? What is barley? Can you beautifully answer in the comment section? I was not knowing about this. I asked my bhabhi, jawar kya hota hai, bajra kya hota hai? I was getting little doubt. Can you beautifully answer in the comment section, please? Hanji, that's very well put. Okay. Okay, Hannibal says, egg chalu karo. Cute. Dr. Hennebert, what's your name, bro? Are you a boy or a girl? I have no idea, bro. Tell me. So what is wheat and what is barley? एक छिलके वाला होता है, एक बिना छिलके वाला होता है. Okay, in English, okay. The left side is barley, right side is wheat, down is oats, side is rye. Okay, then you will say, sir, all four are looking same to me. I'm sorry. Don't worry, bro. For me also, all four are looking same. एक बिना छिलके, okay, English. One is बिना छिलका, one is with छिलका. छिलके की English क्या होती है? Can anyone tell me छिलका? Okay, this there. One is without cover, one is with the cover. W for wheat and W for without cover. Okay, wheat is without cover, barley is with cover. That much only my mom and my bhabi had told. I was not knowing exact differentiation between wheat and barley, so that much only I know. Can we have sarso or mustard? Okay, what is mustard? What is sarso? Beautiful picture. Thanks to digital media. For me, photographic memory plays a very important role. 1 second, let me enlarge it and become super power. Super से भी ऊपर करेंगे जीवन में. Yes. So mustard and sarso allowed? Yes, allowed. Okay, jawar or sorghum allowed? Yeah. So barley, nothing but jong is not allowed. Jawar, nothing but sorghum is allowed. Oats allowed. Okay? Has everyone understood? Yes or prrr? Yes, yes. Put a thumbs up. A beautiful class. Have you understood? Yes or no? Please let me know. And guys, today is 3rd October. Tomorrow is 4th October. Tomorrow we will not have a class because 5th October I have a 12 hours of 9 a.m. to 9 p.m. Delhi class with Cerebellar Academy where we have huge crowd, so I have to revise. That's why tomorrow no class. I have to make a very strategy wala plan, some like a crazy sexy happening plan where students will be like, wow, who is this guy? This guy is amazing. Dr. Anand is amazing. Like that I want to have the class. So full of enthusiasm, full of good vibes, lot of motivating quotes. मतलब ऐसी class होना चाहिए बंदा चेयर पे खुद मतलब आग लग जाए चेयर पे. And we should have a class like this, the offline ones. The student should feel that there is fire inside below the, not, we can't use a non-veg word, below the chair is right now. Shubham, am I right? Yes or yes? See, can we move further in life? Yes or no? आशुतोष क्या बोल रहा है? ढेर पर राई का दाना सीलियक स्प्रू में क्या? ये मुझे बोलना भी नहीं आ रहा. तूने जो लिखा है आशुतोष, उसके ढेर पर राई का दाना सीलियक स्प्रू में नहीं है खाना. Okay, that's nice. Yeah, okay. Let's move further. Again, before continuation, we always have a crazy, mind-blowing, amazing quote and such a beautiful quote. For this quote, I would like to thank Dr. Sawan Singh, one of my very good junior who stays near two gully in English. Gully ki English kya hoti hai? Two blocks away from my house, who had shared this quote to me. Sometimes when you are in a dark place, sometimes when you are in a dark place, you think you have been buried, but actually you have been planted. Such a beautiful quote. Can we rejuvenate from this? Sometimes when you are in a dark place, you think people are abusing you, you think you are so sad in life, you think you are alone, you think no one taking care of you in gym, you think no one is looking at you in the classes, if you think no one is appreciating you, you think you have been buried, but actually you have been planted. Planted for what? Planted for doing something amazing. Planted for being an amazing soul. Tell yourself you are a beautiful soul. Tell yourself you are amazing. Tell yourself you are mind blowing. Do you think you have guts to clear an exam? Can you answer in the comment section, please? Do you think you have the guts? Yes or yes? Can you answer in the comment section, please? Sarthak Praharaj, Shubham, Osama, Rakesh Kumawat. Yes, okay, great. Rakesh says, good evening, sir. I'm Rakesh Kumawat from VMMC Medical College. Hello, sir. Good evening. So I think we have all the bloody guts to be amazing. You should say, sir, I was born a rock star. You need to fall in love with yourself. Frankly speaking, my HOD used to say, before being a good doctor, you should be a good human being. So before being an amazing, you need to appreciate yourself. You need to fall in love with yourself. You need to love your company. You need to be just amazing. You know, I'm telling you, bro, the day you realize your true potential, the day you realize that you are alone, you were alone, you will be alone, you were born alone, you will die alone. You don't need anyone. You are very happy with yourself. That day, If someone loves the self company, the day that person उसने मोक्ष प्राप्त कर लिया है, that person has got the eternal internal soul. Let's talk about continuation. Yes. Karan says मुझे थोड़ा टाइम लगेगा. क्यों लगने दो, हम हैं साथ में. In a case of antenatal history, so sir, let's continue further. What disease do you want to ask in a case of antenatal history? What disease are we thinking of? Ma'am, there is no history of in the mother. What, bro? What in the first trimester, second trimester, third trimester? What disease you want to ask in the mother? Can you answer in the comment section, please? Anyone? Anyone? I've started augmentin. Day after tomorrow is my class. I should be like fit and fine. PIH, yes. P for Priya Gupta. P for pregnancy-induced hypertension. I totally agree with you. So what are the beautiful diseases I must think in the mother which have a bad effect in the baby? Can I think of diabetes mellitus or infant of diabetic mother? So a very simple question. The most common congenital heart disease in a case of infant of diabetic mother is dash. The most specific congenital heart disease in a case of infant of diabetic mother is dash. You have 5 seconds to answer in the comment section. That's true. Yeah, that's beautiful, beautiful, and beautiful. I think we got the pinned message of the evening. Yeah, so the most common congenital heart in infant of diabetic mother is a VSD, ventricular septal defect, which is a left to right shunt, which is a acyanotic congenital heart. The most specific congenital heart is TGA, which is a duct dependent congenital heart, where you see egg on string appearance, and what else? Duct dependent egg on string appearance. What else? What else? Where you see parallel circulation, and where you see two arterial switch and a Jettini repair. I think you are not, I think these are not high five words. We have done this 1,000 times. Perfect. Yeah. And I hope you know that who will be hypoglycemic and who will be hyperglycemic in the case of infant of diabetic mother. Anyone? Yes, the mother will be hyperglycemic and the baby will be hypoglycemic. This is a neat PG question. Remember that, okay? Yeah, the mother is taking insulin. The mother is taking insulin, okay? Why? Her sugar is very high. Her sugar is very high. That's why the mother is taking insulin. Okay, the mother is hyperglycemic and the baby is hypoglycemic. And the why, like the whole theory is modified Pedersen's hypothesis. Dr. Sarthak Praharaj, I hope you remember. We have discussed this, the Pedersen's hypothesis. Yes or yes? Please let me know. Okay, perfect. This part is over. Yes, PIH, very beautifully Dr. Priya Gupta has says pregnancy induced hypertension. What problem a baby can have? Can you answer beautifully in the comment section? In a case of pregnancy induced hypertension, what problems the baby can have? Anyone? You have answers? Yes, Pedersen hypothesis is right. Very beautiful. Yes, Faiza and Raza. Bhavna Mankar. Harris Ahmed. Okay, Dr. Haris Ahmed says why passing percentage in DNB peds is low. I don't know, bro. That's how it has been. I don't know. They make the paper little, they say very level questions, and the theory paper, it's subdivided into 8 and 10, the short answers, long answers, short questions, and the paper goes to multiple faculties all over India. That is why the passing cutoff becomes very narrow. That's why. Yeah, if someone is having pregnancy induced hypertension, definitely very beautifully told by Ritu Satna, Osama Sheikh, Pandey, Bhavna, and Sarthak Praharaj. IUGR, yes, the baby can have IUGR. The baby can have thrombocytopenia, and yes, the baby can be a premature baby if the mother is a case of PIH. IUGR. Can you please tell me in which type of IUGR the insult to the mother is from the beginning? In which type of IUGR the insult to the mother is from the beginning? Can you answer me yes or no? कैलेंडर चाहिए क्या आपको? कुछ नहीं चाहिए, गलत अच्छा कैलेंडर पड़ा एक्स्ट्रा कर चाहिए. Yes, that's right. So that's answer to मुझे. Yes, that's very right. In which type of IUGR, the insult to the mother is from the beginning. I hope you know that. In a case of symmetrical IUGR, the insult to the mother is from the first trimester. From the first trimester, if the insult to the mother is there, that means the baby will be totally compromised from the beginning. Example, very importantly, genetic defects. The example, the causes of symmetrical IUGR are genetic defects, chromosomal defects of or TORCH infection. In all these infections, it's from the beginning. If the mother is, if the baby is having Down syndrome, it's a congenital problem, it's a genetic problem. The problem is from the beginning, from the first trimester. So baby's head will be small, liver will be small, kidney will be small, biceps will be small, triceps will be small, chest will be small. The baby will be totally compromised. That is known as symmetrical IUGR. Whereas in the case of asymmetrical IUGR, what is IUGR? Intrauterine growth restriction, not retardation. बच्चा पागल पैदा नहीं हुआ, बच्चे की growth restricted है. Baby is not mentally retarded. Baby's growth is slightly on a scale restricted. Why? Because of these conditions. I hope you know that. I hope you know that we have symmetrical and asymmetrical IUGR. Symmetrical IUGR, the insult to the mother is from the beginning. So insult to the baby is from the beginning. Whereas in a case of, yes, yeah, that's true, Sarthak. So in a case of asymmetrical IUGR, the insult to the mother is from the second trimester, or you can say that the end of the first trimester or the second trimester. So why that point is important? I hope you know that. The brain development of the baby happens in the first trimester. That is why in a case of asymmetrical IUGR, the brain will be normal, but rest of the body parts will be compromised. The baby liver will be small, kidney will be small, intestine will be small, everything will be small except the brain. The brain will be normal. Why? Because the insult to the mother in this type of IUGR is in the late first trimester or the second trimester. That is why this is known as asymmetrical IUGR. And what are the causes of asymmetrical IUGR? The causes of beautiful asymmetrical IUGR are, I hope you know that, you can say very importantly, maternal anemia. Yes, maternal anemia is in the causes of asymmetrical IUGR. Mother is not gaining weight. Uteroplacental insufficiency, very important. Maternal hypertension. So any insult to the mother in the second trimester, the baby will be having asymmetrical IUGR. I hope you know that. Yes, Dr. Sarthak Praharaj, one of my very good juniors, not my favorite, but one of my very good students who is answering very good these days, who is in touch with me on WhatsApp on everyday basis, who is sending me nice motivating quotes also. So he says that, sir, just an update. IUGR is not used now. We use fetal growth restriction. Very important. Yes, if FGR is nowadays, we can use fetal growth restriction. Done. Has everyone understood this much? Yes or yes? Please put a thumbs up that you have understood so that I can move on in my life and feel happy about it. Yes. आकर चले न जाना, ऐसे नहीं सताना, देकर हंसी लबों को, आंखों को मत रुलाना, देना ना बेकरारी, दिल का करार बनके, सांसों में खो न जाना, तुम इंतजार बनके, इंतजार बनके. Yes, so that's very beautifully right. If the mother is a case of SLE, if the mother is having systemic lupus erythematosus, the baby can have a congenital heart block. It's an exam question. Please remember that, okay? Dr. Bhavna Mankar and Ashutosh had come to Delhi to meet me. I remember on my birthday. Do you remember, bro? On my birthday on 11th March, Ashutosh had come from Chandigarh to Delhi in Connaught Place and I was in a restaurant with my family, and he came just to meet me, I think for 2 minutes, I guess. And he came, he gave me a chocolates, he gave me a bouquet of flower, and he said, "Sir, I just wanted to make this moment memorable. Thank you so much for everything," and that's it. Do you remember Dr. Ashutosh? Yes or yes, yes? I remember it. And one more person who is always jumping here and there is Osama Sheikh. Whatever happens, Osama will always wish. Osama was the first person to wish me on New Year. Osama was the first person to wish me, I think, on last Diwali. Osama was the first person, yeah, the first person who wished me on my birthday. I mean, not my mother also. Osama wished me first. My mom had just, I was just going to be in my mom's room. Suddenly, 11:59. Anand sir, happy birthday. I was like, Osama? Really? I have never met you, but thank you so much. That's very kind of you. तो कुछ लोग आते हैं आपकी जिंदगी में फरिश्तों की तरह. Yes. If the mother is a case of SLE, the baby can have a heart block. It's an exam question, neat pitchy question. The baby, even that could be you can have a spontaneous abortion and a lupus syndrome, that you should know. If the mother has UTI, very beautiful question. Can you please answer in the comment section? The beautiful class is beautifully coming to an end. Some last 10 questions. If the mother is a case of UTI in the last trimester and the last periods of gestation, the baby can have what? The beautiful baby can have a preterm delivery, guys. The baby can have a preterm delivery, that you should know. If the mother is a case of hyperparathyroidism, these are very beautiful questions. Examiner will judge you. You need to know that. You are amazing. Tell, hello, I know this. Sir, if the mother is a case of hyperthyroidism, the baby can have tetany. Please remember, hyperparathyroidism, the baby can have tetany, where you have the chopstick sign and the trouser sign. I hope you know that. Yeah. If the mother is a case of phenylketonuria, can you please answer in the comment section? These all are like one-liners of the last 3-year question papers of NEET PG. If the mother is a case of phenylketonuria, the baby can have microcephaly or can have a heart defect, that you should know. Okay, phenylketonuria, I hope you know that. Phenylalanine metabolism. Okay, Hanji, microcephaly, can you beautifully answer in the comment section? How do you define microcephaly? Yes, Dr. Ashutosh. Head circumference less than -3 standard deviation for the respective age and sex is microcephaly, and head circumference more than 2 standard deviation is macrocephaly. How do you define short stature? Anyone? मैं कुछ ज़्यादा ही आंसर्स बता रहा हूँ. Wait, I will wait. हाँ जी. Tell me. Hello. How do you define short stature? हाँ जी. Anyone? Dr. Rajkumar, Karan Vikram Singh, Osama Sheikh, Priya Gupta, Bhavna Mankar, Shubham, and Surgeon of East / Ashutosh. How do you define short stature? There are 2 definitions. Shubhangi आई है क्या? Shubhangi कहाँ पे है? Shubhangi, तुम आंसर नहीं कर रही, तुम्हारे कमेंट्स नहीं दिख रहे मुझे. Please remember. Okay, Sarthak Praharaj, I will shoot you with my gun. I'm sorry, that's the wrong answer. Height less than 3rd percentile, that is known as short stature, or less than -2 standard deviation. Is less than -2. Sarthak Praharaj, now he is right. Priya Gupta is right. Priya Gupta, less than 2, dear, short stature. And who else? Jitinder Kumar, Bhavna Mankar. Beautiful. If the mother has taken alcohol during pregnancy, last 2 minutes, this beautiful, amazing class is over. And can you tell me? I hope you know that fetal alcohol syndrome, of course. And fetal, if the mother has taken Eptoin, yeah, I know that. If the mother has taken Eptoin during pregnancy, the baby can have dash. Can you please answer in the comment section? Yeah. Fetal Hydantoin syndrome. If the mother has taken Eptoin during pregnancy, the baby can have fetal Hydantoin syndrome. And मेरा पेट निकला है, इतनी पूड़ियाँ खाई है मैंने आज, बाय गॉड, इतना एब्स करके आया हूँ, तब भी देखो, आई एम गेटिंग सो नॉन गुड लुकिंग. What will happen, bro? Any idea, guys? If you get non good looking, what will happen to the future? Can you answer in the comment section? Yes. Okay. Let me hide my tummy. Yes. Okay, tell me. If the mother has taken alcohol during pregnancy, the baby can have fetal alcohol syndrome. If the mother has taken Eptoin during pregnancy, the baby can have fetal Hydantoin syndrome. Yes. Fetal alcohol syndrome. Can you please tell me in the comment section? How does a fetal alcohol syndrome look like? This is the cutie pie baby. Looks very scary. Okay, 1 second. इसको सुंदर बना दूँ मैं. हाँ जी. Can you please tell me in the comment section, how does fetal alcohol syndrome looks like? I am a student who is appearing for INI CET. Can you please tell me, I am a baby of fetal alcohol. Can you tell me how do I look? Can anyone answer in the comment section? Aptoin, yes, Sarthak Praharaj, you're right. Syrup phenytoin is nothing but syrup. This one, Aptoin, that's very well true. That's true, bro. Yeah, okay. And syrup, okay, that's right. सर हम तो खुद मोटे हो गए हैं आजकल. ओसामा शेख, वेरी गुड. सर फैटी हो रहे हो. करण सेज, यस ब्रो. माय टारगेट इज टू गो 90 kg. सर्दियां आने वाली हैं. Winters are coming. Game of Thrones, winter is coming. Such a beautiful series. Now I'm 85 kg. My target is 90 kg. My instructor says you must eat nicely. Every day I'm having aloo parathas, alternate day मूली पराठास, गोभी पराठा, हरी मिर्च का पराठा. मैं भाग भाग के हॉस्पिटल से आता हूँ कि मम्मी मुझे पराठे बना के खिलाएगी. I run coming from hospital and my mom makes, what do you wanna have? Aloo paratha. Okay, fine, I'll make it. That's nice. Okay, yeah. I recommend everyone to have देसी घी. देसी घी लें, सुस्त सुस्त कह रहा हूँ, तंदुरुस्त हो जाए. प्लीज हैव देसी घी. देसी घी की इंग्लिश, देसी घी तो देसी घी होता है ना शुभम. इंग्लिश क्या होगी? देसी घी. देसी घी की इंग्लिश मुझे पता नहीं, आई एम सॉरी. Yes, that's very beautiful, right? If I'm a case of fetal alcohol syndrome, I will have microcephaly. I will have a low set tears. Hello, low set tears you can get in every places, but low set tears you should know. Examiner will judge you. He will ask you, how do you define? How do you define low set tears? Then you should proudly, like a proud, happy doctor, and say, sir, if I draw a straight line from the medial canthus to the lateral canthus, if I draw a very cute straight line like this, then 1/3 of my beautiful ear lobule should be up and my $1,000,000 lower 2/3 ear should be down. This is like normal. This is normal. If I draw a straight line from the inner canthus to the outer canthus, from the medial canthus to the lateral canthus, and then straight line. Don't say from the lateral canthus. Stay from the medial to lateral to this. If they ask you, where have you read this? Sir, standard book I have read, sir. Like that you should say. Okay, standard, but the examiner should not think that you are arrogant. Say I have read from Hutchinson, or in the pediatrics you can say Piyush Gupta clinical books. Yes, okay, that's right. करण से मुझे और छोटा और थिन होना है. छोटा एज इन हाइट, छोटी करनी है तुम्हें, आओ तुम्हारी टांगे काटूंगा. Yes, the patient will have microcephaly, low set ears. हाँ जी, लिप, एक मुझे लिप सुनाने नहीं आते. I should take classes for my niece. This is very scary lips, okay? I wish no one should have that lips. Thin upper lip. Can I please write thin upper lip? And can I write smooth philtrum? Smooth philtrum. Can I be IUGR if I'm having fetal alcohol? Yes. Can I have a developmental delay? Yes, you can have. Tell your mummy not to have alcohol because you can have a developmental delay. And what else? Can I be a case of holoprosencephaly if my mummy is taking alcohol during pregnancy? Yes. Is holoprosencephaly a neural tube defect? Can you answer in the comment section, yes or no? These are like very beautiful knowledge. Can we appreciate this day and this evening where we are sharing this immense amount of knowledge? The answer is holoprosencephaly is not a neural tube defect. फिर क्या बना है ये? What is this? Sir, this is a forebrain anomaly. This is a forebrain anomaly. Is everyone understanding this hi-fi knowledge which I am giving, or everything is going above the beautiful head? First tell me, put a thumbs up. Are you understanding? या सब कुछ दिमाग ऊपर से जा रहा है? न करण मिल से ऊपर से ही जा रहा है, मुझे तो पढ़ना पड़ेगा. Yo, this cold, what should I do? Apologies, but I don't have this habit of sudko ki English I don't know. I don't have this habit of inhaling my cold. It's a bad habit. You get a very bad headache. Blow it. Other person will feel odd. Let them feel odd. You're feeling odd. You were born odd. You should say that. It's so funny. I'm so funny. Yeah. Okay. हाँ, Shubham has put one sign. क्या क्या चाह रहे हो तुम जीवन से? क्या क्या चाहिए तुम्हें बताओ? नहीं है मेरे पास. क्या चाहिए? Yeah. Done. I hope you've got it. Perfect. I think let's finish this beautiful class. Can we have a, do you want guys a recap? Yes, or what else? Yes. 9:31 my mom will call for dinner. समझ में आया या नहीं आया? Say a yes. Yes. Okay, beautiful. Shifali Aneja, Kalicharan, Grace, Sharon. Okay. So, okay, and also in fetal alcohol syndrome, you'll have a short palpebral fissure, smooth philtrum, microcephaly, thin upper lip, and what else? What else? A holoprosencephaly, IUGR, developmental delay. Your brother knows. Should be proud. Okay, done? Done. Okay. Hannibal, what's your name? Okay. करण कह रहा है भंगड़ा करो सर. हाँ, वेरी क्यूट. तुम्हारी और कोई ख्वाहिश है? कोई और ख्वाहिश चाहते हो? एक मूवी आई थी मुझे याद है, और चित्रांगदा और शाइनी आहूजा की हजारों ख्वाहिशें. ऑस्कर आ गया. ऑस्कर, दरवाजा कौन बंद करेगा? बारात आई है. हेलो, टॉकिंग टू यू. बड़ा ढीठ है, बिल्कुल करण पे गया मेरे ख्याल से. हाँ, ठीक है, डन. Vermicillion. What is that vermicillion? Himanshu Kanga. Okay, let's have a beautiful recap and then let's do some chit chat. Okay. In this beautiful class, guys, what have you understood? We have understood life is beautiful. We have understood that we need to work until we feel that Dubai is cheap. The very crazy line. I love it. Today I was checking the motivating quotes and I was like, work until you feel Dubai is cheap. It's like, yeah, no, that's right, Dubai. But I was like, then I, what I was thinking? I was thinking, but for me, Dubai is cheap only. The last 2 months back, I went to Dubai, it was cheap. Then I was like, no, don't tell to everyone. They will think you are very arrogant. Say Dubai is very expensive, very expensive. So yes, guys, please remember, we need to work hard until we feel Dubai is cheap. Also at the same, a quick 30 seconds quick discussion. In this beautiful class, we have covered the past history and the antenatal history. In the past history, we beautifully understood the CVS causes, as in history of Sucrase cycle, tetralogy of Fallow, cough and cold, acute rheumatic fever, rheumatic heart disease. The name of the criteria for acute rheumatic fever is revised John's criteria. And what is the criteria for infective endocarditis? It is Duke's criteria. Dr. Hennebert says, sir, I'm Shiv. I'm from Mumbai. I asked about your classes in Mumbai. Please WhatsApp. Yes, bro. WhatsApp me. I'll send you the Mumbai details. No problem. Then also beautifully we understood in that the GIT causes. If I'm having constipation, please think of Down syndrome, cystic fibrosis, Hirschsprung disease, celiac disease, and Marfan syndrome. That we understood. If I'm having jaundice, please think of acute viral hepatitis. If I'm having history of blood transfusions, think of if I'm having transfusion dependent anemias or thalassemias or sickle cell anemias. And where what else I will be having, what else, transfusion dependent anemias, I'll be a child, but till 9 months of life I'll be okay, and then I'll show you the symptoms because of the compensatory effect of the fetal hemoglobin. Then also beautifully we understood the past history of, in a case of chronic diarrhea, I must rule out kind of a inflammatory bowel disease, ulcerative colitis, Crohn's disease, celiac, and cystic fibrosis. And one beautiful take home message, celiac disease, where I'm having gluten problem and this and that, I will have diarrhea or I can also have constipation. Oscar, अब फिर तो दरवाजा खोल के जाएगा. इधर बैठ जा. इधर उसकी बड़ा बदतमीज है, बड़ी ढीठ औरत है ये. हाँ जी, नेक्स्ट क्वेश्चन. दिस वी अंडरस्टूड. हिस्ट्री ऑफ कॉन्टैक्ट वी अंडरस्टूड. आवर्स वाला इज इंपॉर्टेंट ब्रो. ऑस्कर, देख रहा हूँ तेरे को मैं, सब नजर है मेरी. या history of contact. If you and me are together more than 15 hours per week or more than 180 hours in the I'm carrying total infectious period, either one of us is having a history of contact. In the antenatal history, you need to ask the mother. अच्छा, अकड़ पूरी है भाई, पूरी अकड़ है, पूरा शुभम पे गया है. बाय गॉड. उसकी इधर चप्पल कहाँ है मेरी? क्या चाहिए तुम्हें? क्लास चल रही है, यू नीड टू बिहेव. ओके, यू नो टेबल मैनर्स. कोई है, सब एक ताली के चट्टे बट्टे हैं. हाँ जी. If the mother is a case of pregnancy-induced hypertension, what I should think of? You can think of IUGR. The baby can be IUGR. The baby can have developmental delays. If the mother is a diabetic, we have beautifully understood that whole part. The mother will be hyperglycemic, baby will be hypo. What else? We have done that very easy. If the mother is a PIH, IUGR, thrombocytopenia, premature delivery is very well thought of. Then if the mother is a case of SLE, the baby should have a heart block. If the and also spontaneous abortions and lupus syndrome. If the mummy has UTI, baby can have a preterm delivery. That's important. If the mother is having maternal fever, also the baby can have a preterm delivery. And if the mother is a case of hyperparathyroidism, the baby can have tetany. If the mother is a case of phenylketonuria, the baby can have microcephaly and heart defects. Mother is having alcohol, the baby can have fetal alcohol syndrome, where the baby will have a microcephaly, low set ears, smooth philtrum, thin upper lip, IUGR, developmental delays. What else? Developmental delay, IUGR, and holoprosencephaly. यस, ओहो ओहो, फैजान रजा, सर नहीं डांटो उसको, क्यूट है वो। अच्छा वही क्यूट है, हम क्यूट नहीं है। हम बुरे हैं। मेरे चेहरे पे क्या कुछ, चेहरे पे काले दाग है मेरे चेहरे पे, वो क्यूट है। ओके। करण सेस मेरा फोन हैंग हो गया था। आई रिकमेंड यू टू बाय अ न्यू फोन, आई थिंक आईफोन 13 प्रो इज अ गुड चॉइस, मे बी 14 यू कैन से। भाभी मेरा दरवाजा बंद कर दो प्लीज। Has everyone understood? Can we leave this planet? I'm not the planet, but can we leave this class? Okay. Can we say bye bye to each other? Has everyone understood? Yes or no? हो गया, बस खत्म खत्म हो गया। Perfect. Beautiful. Okay. Tomorrow there is the next 2 days, guys. We don't have a class. Why? Why on this planet we don't have a class? Will you miss me? Yes or yes? Please let me know. Okay. Because why we don't have a class? Tomorrow is 4th October. I need to revise because 5th October we have a class in Delhi in some stadium. I need to tell you. You wanna know what stadium I'm going? Wait, I'll tell you. बस लिस्ट तो आई थी एड्रेस की। हाँ, सो इन वी हैव सम अमेजिंग सेशन गोइंग ऑन विद 600 स्टूडेंट्स ऑन द 5th and I think 17th 8th in Mumbai. I have a class on 18th or 19th. I have a class in Mumbai. That slot is already booked. The show is houseful. There are no more seats. Everything is full. Delhi class is full. There are no seats. So just enjoy life. That's it. I'm so happy. समझ में आया कि नहीं आया? In this another upcoming classes, we will understood that how much radiations in the mother is allowed if she's having X-rays and all that. Then trimester history is important, that if the mother has some infection in first trimester, what should be worried about and all that. Then also very beautiful, if the baby is a case of dash, you should think of dash, what is this, we were going to talk about it. And yeah, if the mother has taken all these amazing drugs, the baby can have what all, this we're going to talk about. If the mother has taken statins is important, the baby can have vectoral anomalies. Vectoral में T क्या होता है, what is T, that's an exam question, we're going to cover after 2 days. Okay. या बहुत सारा है, बहुत जो बोलो वो बहुत सारा। हैज everyone understood? Thank you so much everyone for this beautiful participation. I hope you had a good time. Okay. Danka, yes, voice is super und, oh मुझे बोलना भी नहीं आ रहा। Great. Take care. Bye bye. Thank you so much. Life is beautiful. Please take care of yourself, and you are on your own. The journey is amazing. Just enjoy. While working out, enjoy every reps. While going to gym, while if you're dancing nicely, while dancing, tell yourself enjoy. If you like running, while I'm telling you this, it's gonna work, it's gonna be really nicely work. Okay. If you like running, while running, tell yourself it's the last day of your life, you're gonna run, and you need to enjoy breathing. Okay. If you like skating, like bhangra, like whatever you want to do, just tell yourself again and again, I'm enjoying this. Enjoy the workout, enjoy the journey, smile for no reason, let's have a good time. And I'm telling you, you will be super positive, your aura will be so attractive, people will jump on your head only. And that's what, so that happens to me a lot of times, so that will happen to you also. Thank you, take care, and bye bye. Yes, Dr. Karan is right. If the mother has taken erythromycin during pregnancy, the baby can have congenital hypertrophic pyloric stenosis. That's right. And Sarthak Praharaj, I have one question to you. Homework. The homework is, what is global developmental delay? How do you define global developmental delay? And can you tell me two differential diagnoses of global developmental delay? I'm gonna take a, like MBBS third year has a, in my college MBBS third year exams are coming this month end, so I'm gonna make a question paper, and this question is really important. Define global developmental delay with the two differential diagnoses and explain one in detail. Simple, easy question on this planet. It's a homework, guys. Next class, please remind me about this question. It's important. Today only I was reading, that's why I'm sharing. Bye bye. Bye Osama. Please take care. कोई शायरी लिखी है Osama ने? नहीं, अभी आज शायरी नहीं है. ठीक है, done. Please take care. Bye bye. Lot of respect.